بسم الله الرحمن الرحيم. مع جزء من السلسلة اللي احنا شغالين فيها اللي هو use your brain أو شغل مخك أو brainstorming. العيان بتاعنا 55 years old were intensive Ramadan city. Someday on going to work in a cold windy atmosphere he came complaining of watering of the right eye. Our patient has a history of diabetes. This is the external appearance of our patient. Pupillary reaction to light was normal, no abnormalities. The intraocular pressure was 14 and 15 mm mercury in the right and left eyes respectively. Posterior segment examination was unremarkable. What is your diagnosis? Explain the cause of watering. How to manage. What are the possible complications? Thank you. Key to diagnosis of this case. Right Bell's palsy with paralytic atrophy. What's Bell's palsy? Bell's palsy is also known as acute peripheral facial palsy of unknown cause. Can occur at any age. The exact cause is unknown. It is believed to be the result of swelling and inflammation of the nerve that controls the muscles of one side of your face, or it might be a reaction that occurs after a viral infection. Many viruses have been listed or incriminated to cause Bell's palsy. If we speak about the risk factors for Bell's palsy, many risk factors have been reported. Pregnancy, upper respiratory tract infections such as flu or cold, diabetes, positive family history, diabetes as we mentioned, autoimmune disorders, chemotherapy. The cause of watering is the interruption of tears transmission across the sharp posterior border of the lower lid margin due to ectropy. This is the anatomy of the facial nerve. Regarding the symptoms of Bell's palsy, we find drooping of one corner of the mouth, flattening of the creases and folds in the skin, inability to close one eyelid, a sagging lower eyelid, letting tears to spill onto the cheek, heaviness or numbness of the affected side. The paralysis can cause food to collect between the teeth and the lips, and saliva may dribble from the corner of the mouth. Some people with Bell's palsy become painfully sensitive to loud sounds. Diagnosis is essentially a clinical one. Bell's palsy usually causes characteristic signs that can lead a skilled clinician to the right diagnosis. He or she must also rule out the possible causes of facial paralysis such as a stroke. There is no specific laboratory test to confirm that a person has Bell's palsy. We may use electromyography that can confirm the presence of nerve damage and determine its severity and how much of the nerve is affected. MRI or CT scan can rule out other problems that may be putting pressure on the facial nerve. We may use blood tests to check for the presence of bacterial or viral infection. The key to management. Management is divided between the physiotherapist and the ophthalmologist. The physiotherapist first uses corticosteroids. Corticosteroids reduce edema, improve cranial nerve regeneration, and enhance motor function, especially if given in the first 72 hours of Bell's palsy on. For severe symptoms, some recommend antiviral drugs. Pain relievers and moist heat may be used. Physical therapy to stimulate the facial nerve and maintain muscle tone may be taken. In advanced cases, plastic surgery may be used. Regarding the role of the ophthalmologist, lubricating eye drops during the day and lubricating ointment at night. These are examples of lubricating eye drops and lubricating eye ointments. Therapy may be used in advanced cases to prevent or treat exposure keratitis. The most serious complication is exposure keratopathy, which affects the lower third or the lower half of the cornea. These are examples of exposure keratitis complicating Bell's palsy. Thank you.